Okay. Good morning, ladies. Thank you for taking time to come to this nursing in service on teamwork. We will be utilizing the strategy of problem-based learning to do that. My name is Angelina Pitts, and this video will meet the partial fulfillment of the requirements of Nursing 5309, Teaching and Learning Strategies and Evaluation, Dr. Susan Ward, at the University of Texas at Arlington. So just to kind of give you an overview of what problem-based learning is, so we'll have some direction as we discuss our teamwork scenario. McGarry et al., as cited in Cooper and Carver 2012, says that problem-based learning is a popular approach being used in nursing education today. Problem-based learning is also noted to be a student-centered approach using real-life problems to trigger learning through small group communication that explores and examines issues. Students are self-directed learners and take an active role in their learning. Some of the benefits of problem-based learning, as stated by Crookes and Walsh 2013, is that it equips the nurses with skills in critiquing info, problem solving, communication, and higher level thinking. So in the scenario, we have a nurse, Rick, and Susan, who's his PCA for that night, providing care to a patient admitted with severe weakness and altered mental status. The patient was diagnosed with esophageal, liver, and breast cancer during this current admission. Prior to the shift, the sitter was discontinued and a low bed with an alarm was ordered for the patient's safety because he was still somewhat confused and trying to get out of bed. Pertinent history for this patient includes 5 strokes with left-sided weakness and paralysis and alcohol abuse. Rick is assigned 5 patients, all with complex needs. He's also a novice nurse and new to the acute care setting. The patient's bed alarm sounds, yet no one goes to the room because this is Rick's patient. When Rick does get to the room, the patient is sitting on the side of the bed and has thrown his telemetry monitor across the room. The bed is still alarming. There's an IV pump in the room also, which is alarming, and the patient is obviously agitated. Rick asks the patient how he can help, and the patient says he threw the monitor to get his attention so he could stop all the noise. Rick asked why he didn't use his call light, and the patient states because he could not find it. Recall at shift change, the patient was changed to a low bed. It appeared that the bed's handheld call control was not attached, and the patient had no way of summoning for help. So now the small group will discuss teamwork according to the principles of problem-based learning.
And first of all, the problem was safety. I mean, the patient, right at shift change, the patient we weren't making sure that the patient had his call light.
Right. The alarm's going off, and because it's not my patient, I'm not going to go in, and that's a big. I mean, the patient could be doing anything in the room at that time.
Exactly. And considering where is the PCA,
Right.
if he was, with another patient, then she should have been, she should have been aware that, if you hear an alarm go off, go and see what's going on. And
what if we made sure, like you said before, that the patient did have his call light, and make sure it was in his hand, that he knew how to use it, even though he's kind of altered. You really don't know how much he's going to remember and how to use it, but at least, you try to get him to have the call light, to have his, some sort of help.
Right. Being in a low bed is great for the patient, but like you said, not having the device is important. And also considering the patient's medical history. He's had 5 strokes, left-sided weakness, paralysis. I mean, there's a lot going on.
There's a lot of fall risk.
Yes, a lot of fall risk. And I think in looking at this, talking about Rick's demeanor as he walked into the room, he's asking, what's going on, instead of, if you have an IV pump alarming, the bed is alarming, the first thing you want to do is ask about the patient, then I don't think he's happy with his job.
Right. Right. And you know, it's all about teamwork. I know the aides there is to help too, but you can get another. You know, you're all assigned. You have your assignment. You have your hall buddy, so to say, your other nurses. You know,
Right.
hey, you communicate. I have this going on with this patient. It's very high fall risk. You know, just help me listen for the alarm
Right.
and go to the room as quickly as possible.
Without that, I mean, satisfaction at work, you're not going to be satisfied.
Right. Without teamwork, there's just you drown, and there's just no way.
And I think that in reading this, at this point, although patient education is important, we also need to educate the staff, because if no one's going in to check the patient, and if his demeanor is lackluster, then you need some type of education. And I think maybe in service, or you have your lunch break and they talk about certain things, or you can even utilize online resources if you need to.
Right. I saw this article on the internet for patient safety, the impact of teamwork on missed nursing care as far as work resources go.
Well, I looked under Google Scholar about staff teamwork and job satisfaction.
And I have something here from Royal College of Nursing, and it's basically just telling you about teamwork, just the basic definition so everyone knows what teamwork means.
Okay, ladies. Well, that was a great discussion using the problem-based learning technique. And so just can someone say what would be one effective way of teamwork? I heard some ideas as far as relating to communication and just people being aware of what's going on in their surroundings. So in line with that, would someone say one either negative or positive thing relating to patient safety and teamwork in regards to this scenario?
Well, without communication, without letting someone know that this patient is altered, he's a very high fall risk. If no one knows what it is they can help you with, then they might not know how to help you.
Okay, so
Patient
communication. Okay,
Yes.
patient harm, falls.
Yes.
Okay, so then as far as the other regarding teamwork, would you say that Rick is a satisfied nurse with his job and or his coworkers?
No.
Okay, so another negative thing with the lack of teamwork would be decreased job satisfaction.
Right. Mm-hmm.
So, okay, well, does anyone have any questions? Okay, well, I thank you ladies for coming to this nursing in service. I will let your directors know that you attended.
Thank you.